We'd like to welcome in Dr. James Bingle. He's the president of Heart and Vascular Institutes with ProMedica. And Doctor, we want to kind of talk more about the reason for the red. So let's start right there.
Well, red, it's February, and this is Heart Month, and we have made a real push, particularly for women's heart disease, and trying to bring it to the forefront. It's always been kind of back there and not known about as much, but women are more likely to die from heart disease and all cancers combined. And it really is amazing when you bring that to people's minds, because they think heart disease is a male disease, and it is not. So we have them wear red. If you look around the arena, there's a lot of women in red today, and this February 1st is a wear red day for bring heart disease into the forefront.
Yeah, really an important topic, as you just mentioned, and really more so about women. I mean,
Yeah.
this, no one, you wouldn't really figure that. And I mean, it's amazing when we start bringing stuff like this to light.
Well, we a few decades ago, men were at. Actually, men had more heart disease. People didn't live as long either. The other thing is people are living longer. Women are protected somewhat hormonally until they go through menopause. And once that happens, they catch up pretty quick with men. There's some bad habits that have brought it to the fore. Smoking's off the wall, and anytime you can knock out smoking, you're going to knock out some of my business, which is great. Weight, obesity is a big issue, and also leads to heart disease. And then inactivity. Our society tends to be more inactive than we were before, and those three factors, people living longer, the lack of exercise, and what we eat, and smoking, are big deals for women having heart disease.
I talk a little bit about what you guys do there at the ProMedica Heart and Vascular Institutes, trying to help be more preventative with this.
Well, we brought together three big specialties that take care of heart disease and cardiovascular disease. Actually, it's vascular surgeons, heart surgeons, and cardiologists, which is what I do. I'm a cardiologist. And from a preventive standpoint, the things that we harp on and we chase and we pound on our patients every day is know your blood pressure. It can be controlled. Know your cholesterol. There are medicines for that that are phenomenal now. Diabetes. You got diabetes, you got to watch what you eat. You're losing weight. You can get rid of the diabetic drugs and really reduce your risk. Smoking and the exercise deal. And those are things that we pound on every day as an institute. And we've tried to bring it to the fore. Education is one of our main focuses as an institute. And we really have three people we try to educate: each other, physicians, our people that work with us, nurses, techs, everybody else, and then the lay public. And lay public is by far the biggest audience and the one most ready to listen sometimes.
How can people get more information about what you guys do?
Well, we have a website, promedica.org is a great site, and go to the Heart and Vascular Institute site. In fact, there's a heart healthy quiz you can take and get a handle on what your risk is in the next 10 years for having a heart issue and meeting me, which you don't want to do. And then also American Heart has a goredforwomen.org website that's got a fantastic amount of information, a lot of it aimed at prevention, because that's what you want to do. You don't want to have this. So often a person stops smoking after they've had their first heart attack, and it's a little bit of water over the dam. Sure, they're going to do good because we can do so much now that we couldn't do before, but still we'd love to catch them earlier.
Well, Dr. Bingle is certainly a guy that I'm happy I met you in this setting.
Yeah, exactly.
Not necessarily in other settings.
A lot better
for
than
sure,
being elsewhere.
But certainly appreciate everything you guys are doing, bringing this issue to light, and thanks so much for joining us
No
tonight.
problem. My pleasure, man.